Arlington has a personal stake in the use and overuse of drugs. Narcan is an opioid antagonist that can protect individuals from overdoses and save lives.
Well, we saw an increase in overdoses from heroin, and we felt that there was just more that we could do as a community. So we partnered with the police department, working with the fire, police, and other partners in the community. We came together to offer this event.
Well, obviously we've been wrestling with some overdoses in Arlington, and our Director of Health and Human Services, Christine Buongiorno now, and I work very closely together. And some of our police staff members had seen this presentation as part of their police training. And they came back and enlightened me on the topic. And we began to work with Christine Buongiorno and her staff, and collectively we put it together. There's been a number of incidents where folks have dialed 911 and first responders have responded and administered Narcan. As you know, since last October, there have been 4 fatalities, unfortunately. But there also have been many saves, many Narcan saves. And so we hope to be able to increase that and decrease the fatalities.
Mary Wheeler brought street sense practical advice on how to administer Narcan.
The Narcan literally goes into my brain, right, through my bloodstream, whether it's injected into fatty tissue, injected into a vein or a nasal spray. You never inject Narcan in someone's chest, despite movies. Nasal spray hits my bloodstream, goes into my brain, kicks the opiate off my receptors and covers them. So all that drug is still in there, right? But it can't get back onto the opiate receptors.
For Arlington resident Mike Duggan, this is a personal battle.
Part of the process that I had the biggest trouble with was getting help and asking for help. Most of the time I would try to just push everybody who cared about me away and surround myself with people who were getting high like me, because that's who I felt most comfortable with. And if I was trying to get help, I try to do it on my own, and it's not an easy process. A lot of times people say, well, they have to do it on their own, and I get that. As far as getting out of a program, there's work they have to do every day to take care of themselves. It's a lifelong process, but getting into a program is not easy. It's a tough process to navigate through. The resources are there, but sometimes it's not easy knowing what resources are there. And having gone through it myself, you're a little bit more comfortable talking to somebody who's gone through it. You don't feel judged. You don't feel like they're harassing you or looking down on you as much. So,
well, I think success would be measured by, as a result of the partnerships that we're seeing here tonight, that moving forward, that we could decrease the incidence of overdose deaths in Arlington to 0. And I don't think that that's an unrealistic goal.
Anyone that missed the presentation tonight and missed actually receiving Narcan can contact our office, the Department of Health and Human Services, and we'll connect them with the appropriate resources.
As of May 9th, local Walgreens pharmacies do not carry Narcan, but we will update you with any news. More information on Narcan can be found at learntocope.org. I'm Hannah Perlmutter with Arlington Public News.